Au sommaire de ce JT, on a fait un stop chez Lunit. Koios introduit l'intelligence artificielle dans l'échographie. Et enfin, jouer à Trackmania pendant un examen d'IRM, c'est possible. On voit ça en fin de journal.
La médicale vous présente le journal du RSNA.
So Brondon, what makes this company different in terms of technology?
So Lunit is well known for its very high-end AI technology. So we've been recognized to have world-leading deep learning technology in various competitions where we beat competitors like Microsoft, Google, and IBM in terms of having very high performance. And it's actually been demonstrating within the performance level of our product, where our products has been demonstrated to be significantly better than that of radiologists in terms of the performance level, and to significantly have that clinical outcome. That's really the most important thing.
Why would you say it is better? It's better because you use much more data? It's better because of the algorithm? It's better? What is it better?
So that's all together. So one, in terms of the background AI technology, that's like the starting point. We have very high-end proprietary deep learning technology that's quite different from other companies. And we also have managed to collect an unprecedented amount of data, millions of images from various sites from the world. And that really makes a big difference as a whole, combined.
Okay. So we understand why you're better than other company. Now give me an example of what you do with AI.
I think the most important thing is actually the feedback that we get from the customers, because it's really about what the customers really feel, and the accuracy level is actually being felt within how the clinicians actually use our algorithms. So they significantly benefit from our algorithm, and the actual reading time of the radiologist actually significantly decreased, like more than 50%. So the customers actually feel that. I think that's really the big difference.
So as far as I understand, the relationship you have with the customer is really important to improve your AI. And yes. As much as you learn with your customer, and you have a learning curve that goes with your customer. Is that right?
I think that's very similar to all AI. That's the beauty of AI, as it can be constantly evolving. It can be constantly improved with time, with more data, with more experience. So yes, we've been constantly having that experience to grow with the customers.
So let's see an example of what you can do with AI.
So one of the products that we're developing is AI for mammography, which is the most basic screening modality for breast cancer screening. This is an example of a case that we use in our clinical study. It's a case where only 5 out of 14 radiologists got this correct. And then after the radiologists looked at the AI results, 12 out of 14 radiologists got it correct. So like 7 actually got it correct by looking at the AI. So it was a very good example of a case that radiologists can definitely benefit from using AI.
Radiologists, but not only radiologists, because if we move here, I can see that 24% cancer detection, that's an improvement in detection, but also there is an improvement of about false positive recall, yes, which means a lot of stress for the patient, and it means also saving time with reading. Is it all about breast cancer?
So this particular study is focused on breast cancer. And in terms of cancer detection, it's also very important to increase the sensitivity of cancer detection, but at the same time, by actually decreasing the recall of unnecessary biopsies or unnecessary procedures, we can decrease the medical cost involved and also the pain involved for patient experience. And also from a workflow perspective, hospitals can actually decrease the cost involved overall. So that's all.
Okay, that's also better workflow, better accuracy, better efficiency.
Yes, exactly.
There's a lot of AI inside this machine.
Yes, quite a bit. So what I'd like to share with you is what we've done in partnership with our friends at GE and showcase the new Logic E10 scanner which has a lot of AI in the imaging, and we are an additional partner that allows for instantaneous lesion classification. So instead of just eyeballing and looking and interpreting, we now have hundreds of thousands of images that are used to train our artificial intelligence engine. So once that lesion has been detected, we can look at the software and literally just hit the Koios button, and in 2 seconds or less give you an alignment to a BI-RADS and a likelihood of that being benign or malignant to help facilitate an accurate and streamlined case management for each patient. It's available in the exam room, and it's also available connected into multiple PACS vendors, so it can be used in the viewing room when they're analyzing in the big dark monitors privately or out next to the patient.
And it's going to save a lot of time.
We are already seeing it saves a tremendous amount of time with the technician assisting, getting to an answer more quickly, and it also reduces the amount of time that patients have to wait for results. A lot of times there's that anxiety and the fear. They've had the examination done, they don't know what's going to happen. Sometimes they have to leave and they have to come back. This helps expedite that, reducing anxiety and increasing accuracy.
So here, no time to wait, you get a triage right away.
So exactly. So the intelligence derives from a lot of face recognition that our engineers used to do. And they've adapted that to instantaneously classify a lesion. So when a physician is pulling up a case, he or she has an expert second opinion right there who can identify the suspicious area, take that data that they're nervous about, they want more interpretation. We have hundreds of thousands of lesions all tied to their pathology or follow-up. So I can deliver to that radiologist or that tech the risk profile and the descriptors, all the information that has to go in the report. So if they see this quickly, they can take action versus waiting. This can go to the top of a work list. This can trigger the proper treatment. It also results in the earliest possible detection and diagnosis of cancer. We're catching 1 to 6 more cancers when we're using the software, and we're simultaneously reducing benign biopsies at the same time. That's truly the power.
Not available in France right now, but it's going to be soon.
We anticipate it being very soon. We've completed all of what we need to be doing for our CE marks, so we anticipate in the next few weeks that we will have some good news, and we're super excited to share it with our friends and partners across over in France.
L'analyse du radiologue.
C'est un outil qui va nous faciliter la vie, nous faire gagner du temps et rendre service pour pouvoir éventuellement faire une biopsie immédiatement au décours de l'examen échographique, puisqu'on a la classification BI-RADS ACR qui permet de classer les lésions et de voir si cette lésion est plutôt dans la bénignité ou dans la malignité. C'est un service rendu aux patients et qui est très important, et un gain de temps. Un gain de temps, surtout lorsqu'il s'agit de cancérologie, et combien le temps est important dans ces pathologies.
So Christoffer, what are those strange Google for?
The strange Googles are for functional MRI. So mainly these are now used for researchers to really map the brain and figure out how things work. And the cool part about this goggle is that it's been improved. The field of view has been improved from our last goggle, and the picture is also much clearer. What you can use the goggle for, as you tried, was actually having this 3D movie shown that gives this sort of depth in the goggles, which makes it almost more real when the patients or the people are using the goggle view it, and that allows for the researchers a lot of potential, because as we say, try it and see what you can do with it and figure out something new, cool research.
Alors ça, c'est un écran amagnétique qu'on peut mettre dans un IRM, et alors l'originalité, c'est qu'avec ces lunettes, on est connecté à un jeu vidéo, donc on oublie complètement qu'on est dans un IRM, on est immergé dans le jeu, on pense plus du tout à l'examen. C'est génial pour les enfants, et puis c'est génial pour tous les gens qui sont un peu stressés par un examen IRM. Je suis mauvais, mais je suis mauvais.
La médicale vous a présenté le journal du RSNA.